and welcome back to part 1 of EKG rhythms. So on Tuesday, I posted the very basics of EKG and how to read a PQRS and just literally the bare minimum basics of EKGs. But today I am going to start going into abnormal rhythm. So for today's video, I am going to talk about atrial fibrillation, also called A-Fib. For nursing school and for NCLEX, yes, your huge exam, after all your hard work, you will have to know what it is, the management, the causes, and the symptoms of A-Fib or any other cardiac dysrhythmia. So let's get started. Let's start with the what. So what even is A-Fib? Okay, A-Fib is often a fast heart rate, anything over 100, because remember, a normal heart rate is between 60 and 100. So it's over 100, and it happens when the atria, which is the upper chamber of your heart, does not beat in coordination with your ventricles, which are the lower chambers of your heart. Down below, you will see an EKG rhythm strip, and that's what A-Fib looks like on an EKG or your telemetry monitoring. Next, let's go over what even causes A-Fib. What happens to a patient when they go into A-Fib or they have chronic A-Fib? I am pulling out my nursing notes that I wrote in nursing school, and I am going to read off what causes A-Fib. So causes of A-Fib would be heart failure, cardiomyopathy, a previous heart attack, often called an MI, COPD, chronic obstructive pulmonary disease, which a lot of people get from smoking. You also have your mitral valve disease, and open heart surgery could even cause A-Fib. Now, some people live with A-Fib literally their whole life, and some people just go into it suddenly and then they can come back out of it. But that is when it is really important to know your tele and know what you're seeing. But if your patient's not on a heart monitor or a tele, also called telemetry monitoring, you need to know the symptoms of A-Fib, because you cannot rely on technology to always help you. You have to personally know the symptoms. So let's go into symptoms of A-Fib. So symptoms. I'm going to share a story with you real quick. I had a patient this past week who had uncontrolled A-Fib. So they actually had a heart rate that sometimes dropped down into the 60s, which is normal, but they still were in A-Fib. But then they also bumped up into the 160s 10 seconds later. But this patient had absolutely no symptoms. And that can happen with A-Fib. So just know that A-Fib can cause no symptoms. Or in the other case, A-Fib could also cause heart palpitations. Some people can really feel that beating super fast. It can cause chest pain. It can cause fatigue, which makes sense because your heart is not beating how it should be. The blood flow is not getting to the rest of your body. So put 2 and 2 together. If your heart's not beating right, it's not getting the proper oxygen to your body. When you don't get proper oxygen to your body, you're going to be tired. You're going to be fatigued. And when it's beating super fast, of course you're going to feel those palpitations. Sometimes, unless you were my patient this past week, but most commonly, that's when you will feel that. And one last symptom that you should never take lightly is shortness of breath. And put the pieces together. The oxygen is not perfusing to your lungs. So that's why you're having shortness of breath when you're in A-Fib. So what are you going to do as a nurse when your patient is in A-Fib or rapid A-Fib or chronic A-Fib? Let's start with medications. You could give calcium channel blockers. Calcium channel blockers relax your blood vessels. You could also give beta blockers, which beta blockers slow the heart rate down and decrease the blood pressure of your patient. You could also give antiarrhythmics, something like amiodarone or digoxin. They are going to help bring the heart back into rhythm. Another medication that I see most frequently with my patients with A-Fib is blood thinners. So let's put these pieces together. So when blood is not pumping out of your heart efficiently, you have red blood cells sitting with one another. What happens when red blood cells are just sitting there? They clot. So a huge issue for patients with A-Fib are blood clots, then causing a stroke. So that is why a lot of these patients are put on blood thinners. Most common one that I have seen would be Eliquis. Many of my patients are put on Eliquis, because that is the blood thinner that then helps those red blood cells not clot together. And lastly, one that you may see, which I have never seen in my practice so far, is cardioversion, which you probably don't want to see unless you're working in the ICU or ED. So cardioversion is a procedure where electrodes are placed on the outside of your body and they shock your heart back into rhythm. Now, I've never seen this yet. I might, since I'm going to the ED now, but I have heard this is extremely painful. So guys, that about wraps it up for AFib. I gave you the what, I gave you the causes, the management, and the symptoms of AFib. I gave you a tele strip of what AFib looks like. But if you have any other questions, please let me know. On that, make sure you do study your cardiac rhythms very, very well. Not just for NCLEX, but for your practice one day. I work at a hospital where every single nurse needs to know how to read heart rhythms, and we all are considered tele nurses no matter what floor you're on. And if you do not pass the tele test, you cannot work at that hospital. So please make sure you do take this seriously as you're taking care of people's lives here. Other than that, guys, have a blessed day. I hope you found some education out of this, and I will see you in the next video.